Hey, future healthcare heroes! Today, I'm diving into something super crucial: triage in pediatric emergencies. This guide will help you understand how to prioritize young patients based on the severity of their condition, ensuring they get the care they need fast. Let's get started. First up, why is pediatric triage so unique? Kids aren't just little adults. Their bodies respond differently to illnesses and injuries. That means you need specialized knowledge and skills to assess them accurately. Now let's talk triage categories. In pediatric emergencies, you'll often use a color-coded system. Here's a quick rundown. Life-threatening conditions needing immediate intervention. Think severe respiratory distress or shock. Serious but not immediately life-threatening. Conditions like moderate dehydration or minor fractures fit here. Minor injuries or illnesses that can wait. Imagine minor cuts or mild respiratory infections. For patients who are deceased or have injuries that aren't survivable despite medical intervention. Alright, the assessment during pediatric triage is all about being quick but thorough. Focus on: make sure the airway is clear, breathing is adequate, and circulation is stable. Any issues here need immediate action. Use tools like the Pediatric Glasgow Coma Scale or AVPU scale to check their neurological status. Look for signs like cool extremities, delayed capillary refill, and altered mental status. Assess pain levels using age-appropriate scales and watch for signs of distress. Kids can be subtle about this. Now, there are some special considerations in pediatric triage. Remember, infants and young children might not verbalize their symptoms. Rely on observation and what their caregivers tell you. Also, consider their developmental level. It affects how they react to their environment, including pain and fear. Okay, let's move on to the role of nurses in pediatric triage. Nurses are the frontline warriors here. They quickly evaluate the child's condition using the ABCs and other critical indicators. Recognizing subtle signs of deterioration is key. Based on the assessment, nurses categorize patients, ensuring those with life-threatening conditions get immediate attention. Swift, informed decisions are a must. Nurses explain the triage process to the child and their caregivers in a reassuring way. They also relay critical information to the emergency team promptly. Managing pain and distress is crucial. Nurses use age-appropriate pain assessment tools and initiate comfort measures like providing analgesics or using non-pharmacological methods. Pediatric patients need frequent reassessment to catch any changes in their condition. Nurses monitor vital signs and adjust care priorities as needed. Accurate documentation of all assessments, decisions, and interventions is vital. It ensures a complete and legal record of the patient's care. Nurses work closely with the emergency team to ensure a coordinated response. They may also coordinate with other departments to expedite diagnostic tests. Nurses advocate for the child's needs, ensuring they receive appropriate and timely care. This includes advocating for pain management and necessary interventions. In conclusion, triage in pediatric emergencies is dynamic and critical. Nurses play a vital role in ensuring pediatric patients get the right level of care based on the severity of their condition. Their expertise in assessment, prioritization, communication, and advocacy is essential. Thanks for tuning in. Stay sharp, stay compassionate, and keep learning. You're making a difference.